Hi, I'm Ken. While I'm in hospital, I reckon I've got two jobs, probably three really, if truth be known. First, I've got to look after my health, the most important. Doing the exercises, listening to physios and other team members and so on. And the second thing is to give feedback to the doctors and the nurses and ask questions. And when I don't know and don't understand or need to let them know what my preferences are. And thirdly, really I've got to keep an eye on the farm. You know, you can't just lie here and do nothing. I've got to keep an eye on the farm and make sure that my wife, who's doing a fantastic job, is looking after herself as well. And so they're my three things that I've got to look after while I'm here trying to recover.
Hi, I'm Georgia, Ken's wife. I've been kept pretty busy while Ken's been in hospital. I've got to keep things ticking over at the farm, making sure that the animals are fed and watered and checking that the electric fences are all working. I've organised for our son and neighbours to help out, and I'm really grateful for that, I have to say. When I visit Ken in hospital, I have to tell him what's been going on at the farm, and I think he wants to try and run the place from his hospital bed. But I've met with the physio and the OT and the social worker too. We've got to sort out a few financial things there. Can be quite stressful. But everyone at the hospital is really encouraging, and they're encouraging me to look after my own health too.
Hello, my name is Ivan, and I'm the resident medical officer working for Dr. Swaminathan. My job is to help coordinate Ken's medical care. I see him on the ward each day and review the observations and notes made by the nursing and allied health staff and make decisions based on those. With stroke patients, we are particularly interested in trying to make a definite diagnosis initially, and then we try to see if we can find the root cause of the stroke with the aim that we might prevent future strokes or other vascular events. We also look for particular conditions that stroke patients might suffer from, which could be anything from pressure sores to depression or pneumonia, amongst other things. In regard to his rehabilitation, we have a role in coordinating his care and communicating with all the various team members and acting on any of their concerns. The medical team has final responsibility for all major treatment decisions.
Hi, I'm Helen, one of the nurses on the stroke team. I help Ken with his day-to-day needs, such as bathing, dressing and taking his medications. I carry out regular observations of Ken's vital signs, assessing his skin for pressure areas and monitoring his fluid and food intake. I encourage Ken to mobilise as much as possible and to help him to change position to prevent pressure areas when he's in bed. I play a key role in communicating with Ken and ensuring that other team members are aware of his needs. Ken is fortunate he can communicate well, but some stroke patients have trouble speaking.
G'day, I'm Dave, the physiotherapist. When I first met Ken, I assessed the strength and movement of his arms and legs. First he couldn't move his right arm and leg, and as the muscle function gradually returned, he was very weak on his right side. We developed a plan to compensate for the weakness to allow him to mobilise in bed. And we've been working on exercises to help him regain function in his right arm and leg. Ken has a good chance of near full recovery, and as his strength has increased, I've been able to introduce walking aids to help him mobilise to the bathroom. We're building on this strength. We're giving him short trips around the ward, and now we're working on exercises in the physio gym.
I'm Natasha, the occupational therapist. I've been working with Ken to assess his ability to perform ADLs, tasks of daily living like dressing, showering, self-hygiene, eating. Because Ken's right-handed, he's had to learn to do a lot of things with his left hand. I've helped him develop strategies for doing different things and have given him some equipment to help with this. As the function has been gradually returning on Ken's right side, I've been working with him on hand exercises to improve the strength and coordination in his right hand. If Ken still has a bit of weakness when he returns home, I'm going to organise an assessment of his home to see if he'll benefit from any modifications like shower rails or equipment like a shower chair. I might also be able to assess and provide Ken with advice on his ability to return to driving eventually.
Hi, I'm Sarah, the speech pathologist. When a stroke patient like Ken comes onto our team, my role is to assess his swallowing ability to see if he's safe drinking fluids and eating a variety of foods. If I deem that he's at risk of aspiration, I'll prescribe thickened fluids for him and modify his diet accordingly. When I'm doing this, I work closely with the dietitian to make sure that all of his nutritional needs are being met in an appropriate manner. I also assess his speech and language ability, and if he's having any difficulties at all with speaking or with understanding, I'll develop a management plan to help him regain as much function as possible. In Ken's case, he is safe to swallow food and fluids, and his speech has not been affected by his stroke in any way. So no further speech pathology is required at the moment.
I'm Lakshmi, a social worker. I have provided Ken and Georgia with some information about what is available to them from Centrelink, such as a carer's allowance. They might not need help now, but it may be required down the track. I've also provided Georgia and Ken with the details for the Southwest Stroke Support Group, which is supported by the National Stroke Foundation. I have spoken to Georgia about carer stress, and she has my contact details if she needs them.